So I'm a board certified psychiatrist and I've coached over 160 PMHNPs get clinical confidence in their psychiatric skills, their psychiatric diagnosis making, their treatments, and being able to get better results for patients. So in this video, we're going to be covering the top 5 supplements I recommend any integrative psychiatric provider to start using. So the field is shifting now. Patients don't just want medications anymore. They want integrative psychiatry. They want to be able to utilize supplements and holistic lifestyle and therapy. And so all of these other modalities in their treatment. And so if you're working in private practice, if you're working in any kind of clinical setting, supplements can help you reduce the effective dose of a medication because they can cover some of that benefit. They can help cover a lot of underlying existing deficiencies that are happening. They can help you get more revenue for your practice because now you're going to be getting the patients who want more of an integrative thing. And it separates you from all the other providers who are just using med management for their patients. This, for supplements, for me, has been a huge game changer. Like, I'm able to get patients off medications because of supplements. I'm able to reduce their doses on meds. I'm able to not even need some medications because I'm using supplements. And I'm able to attract patients who are willing to pay higher fees because they want supplements. So it's huge learning this. So now here in this video, I'm going to share the top 5 supplements that I recommend integrative providers to learn. So number 5, and this is actually one of my favorites, it's NAC, N-Acetylcysteine. So this is a detoxifying agent. It's used, for example, if somebody has a toxic exposure in the ED, they will give this to help detoxify that. So that's IV though. We wouldn't use this like that. We would use oral doses, but this is really helpful. So this is one of the supplements that has the most evidence for OCD. For example, if I'm treating a patient for OCD, like I'll start an SSRI, I'll also start N-acetylcysteine at the same time. Like, I think it's that powerful. So the way that the dosing works for N-acetylcysteine is this from the studies. It's about 2,400 to 3,000 milligrams per day. So I like to start with 600 QD and then go to 1,200 BID. So basically, I'll start with 600 once a day, then over the course of, let's say, 1 month, get up to 1,200 BID. So that's the standard treatment dose, especially for OCD. So highly, highly recommend this for the OCD population. I use the supplement all the time. So the only weird things to be aware about it are like the GI discomfort, so GI side effects. So that's why I like to titrate slowly, like over the course of a month. Not just starting them off on 1,200. And patients will say it's got a weird taste. It's a powder. So that's the only downside. Now, number 4. Number 4 is L-methylfolate. Also keep in mind, this is all stuff that I had to learn as an attending. Like, I never learned any of this in residency or fellowship. And so it's only once I became an attending and I got really interested in integrative psych that I started learning this stuff. So if you don't know this, like, it's not on you. Like, it's just not taught in the field of psychiatry. The field of psych is a very pharma heavy field, and like that's where the influence has been. But I think that things are shifting now for integrative care. Meds can be a part of the psychiatric treatment. So number 4 is L-methylfolate. And so the reason that this is very useful is that it's due to the MTHFR mutation. So a lot of people have this. And what does this mean? This basically means that you have folate use for neurotransmitter synthesis. So folate B12, these are needed for neurotransmitters of dopamine, serotonin, norepinephrine. So you need it for all of these. But if you can't make them, it's like if you're trying to build a house, but you just don't have the bricks to do it. Or actually, a better analogy is that you're trying to make a house and you have the bricks, but you don't have enough workers. The mutation, basically what this does is this converts folate to L-methylfolate. So L-methylfolate, and then this in turn makes neurotransmitters. So this is the step where MTHFR is useful. But if this decreases, then you have decreased neurotransmitter synthesis. So what L-methylfolate supplementation does is basically it gives in this one, the L-methylfolate. So if you give the L-methylfolate, then you pretty much bypass this step right here. So patients could have a normal folate, but they may not be utilizing the proper neurotransmitter. So the levels might be normal, but because of this, you're having the L-methylfolate deficiency. Easy way to solve that is L-methylfolate. Basically, this comes in 400 micrograms and goes all the way to 15 grams, which is like a prescription one called Deplin. So usually I'll give a patient either, if there's a deficiency, 7.5 to 15, milligrams, sorry. So you can just pretty much give them 7.5 or 15. If it's too stimulating for them, that's the only side effect, then decrease dose if stimulating. So if you find that a patient has MTHFR mutation, you definitely want to give this, because now immediately you're going to improve the efficacy of their own neurotransmitter synthesis and whatever supplements that they are on. Super important to recognize that. Then for number 3. So number 3 is L-theanine. So think of this like a PRN anxiety agent. For example, I have these caffeine pills, and so these caffeine tablets, they come in caffeine, but they also have L-theanine in them. And that L-theanine, what this does is it helps calm some of the physical side effects of caffeine. So the jitters, the heart racing, all of that. So it calms a lot of the physical, but it also works with the mental anxiety too. So I'll say physical and mental. So think of it like a weaker benzo. I mean, it's much weaker than a benzo and it doesn't use the same mechanism of action, but that's kind of a way to conceptualize it. Basically, the point is that this works immediately. So you can use it for panic attacks, daily anxiety, physical restlessness, akathisia. Basically, think of it like a propranolol combined with the benzo, but a lot weaker version. That's the best way to think about it. And so the dosing for this is, agitation as well. For example, I've used this successfully with autism patients who the family doesn't want medication. So L-theanine can be very helpful for calming. I've used it in another case for tics as well too. So basically the dosing is from 100 to about 500 milligrams for this, 100 to 500. And you can go higher if need to. So you could go to 600 or 700. Basically the only side effect you're going to get from this is sedation. So that's why it's also used for sleep anxiety. It's not a sedating compound, but just given too high, you'll probably get sedation. Basically what L-theanine does is it increases alpha waves. So alpha waves are calming waves. They're the waves that you get before sleep. So it just increases that. Then, basically if you have that, all you know is that you just need to taper the dose back. So I think that this gets dosed too low for a lot of people. Like they might prescribe it. They're like, I take it, but I'm only, you find out they're only on 100 milligrams. When in reality, they might need 500 milligrams. And these are supplements, very, very safe. So number 2 is magnesium. It's specifically magnesium glycinate or threonate. So I think of magnesium like a body calming, body relaxing. So it doesn't work as much on the mental side of anxiety, but it definitely is very calming physically, which in turn can help the mental anxiety. So it's meant for body relaxing. Its uses are for sleep, agitation, Similarly to L-theanine, ticks, like I used to take this for sleep a lot. Yeah, these are the main uses for it. Even anxiety, if you calm the body, you'll still calm the mind. And magnesium I like because a lot of people have deficiencies. So people are deficient. And another thing with this is that you want to use glycinate or threonate. So these are the forms that you want to use because these cross the blood-brain barrier. So these ones cross the BBB. So that's why they're the most helpful. Whereas you don't want to use citrate or malate. So don't use those ones. And the reason you don't want to use those ones because those are more for the GI kind of side effects or maybe some body deficiency, but they won't help you with the cognitive effects as much. In psychiatry, we're trying to target the cognitive effects. This is a big mistake that patients will make. They'll say that, oh, I'm on magnesium, but then I'll always ask them, okay, which form of magnesium you're on? Like, show me the bottle. And then lo and behold, they're on magnesium citrate because it's the cheapest. So that's magnesium citrate and malate. The dosing for this, basically with this one, you can also start at around 120. Typically, like for example, pure encapsulation starts at 120. You can go to about 500, give or take, but even higher if you want to. The main side effect that magnesium has, it's very safe, is diarrhea. If you take maybe like 10,000, then okay, you might have some cardiac side effects, but in standard doses, the main side effect is diarrhea. So all that needs is just to decrease the dose. So magnesium, you can also dose like pretty high. So let's say you're on 500, it's not working, but you have noticed benefit. Then you can keep pushing it up, go to 600, 700, and then you can basically, the limiting factors when the patient says, okay, hey, I have more stools or I have diarrhea. So that's the limiting factor for that. But overall, great supplement. I recommend it so often to so many patients. And then number one, the GOAT, this is my favorite of all time, is omega-3s. So omega-3s, this is the supplement. If I could only recommend one supplement for the rest of my life, it would be omega-3s. Yeah, so pretty much for omega-3s, these make up the inflammatory nature, or these make up the fatty acids of our brain. So basically when we have our brain, this is my brain drawing, you have all these fatty acids that make up the brain. And so omega-3s make that up. Like they'll literally make up the linings of our cells. So it's super crucial to have that. But most of us are deficient in this. So there's two parts of omega-3s that it's very important to understand. So there's EPA and DHA. So EPA and DHA. So EPA, this is anti-inflammatory. So this helps decrease inflammation. And the DHA is the structural component. So there's a prevailing thought in psychiatry that I believe personally is that most psychiatric illnesses are heavily contributed by inflammation, depression, OCD, schizophrenia. Inflammation causes damage to brain cells. If you damage brain cells, you're going to have brain symptoms. Just like if you damage the heart, you're going to have heart symptoms. So typically, I recommend patients to be on 3,000 to 4,000 milligrams of these two per day. So about usually in a 2-to-1 ratio. So this 2,000 and this 1,000. And you can definitely go higher than this. So super therapeutic can be 4,000 plus for severe conditions. But I think that everyone should be on 3,000 to 4,000 milligrams per day. I personally take 3,000 to 4,000 a day myself, either through eating salmon, which I eat like 4 or 5 times a week, or from supplements. And so the reason, there's one way that the manufacturers will trick you, and this is so important, is I remember one time I had a patient and she was like, yeah, I'm on 2,000 milligrams a day of omega-3. And I was like, oh, what kind? And so she goes, the Trader Joe version. So I look up the Trader Joe version literally right in front of her on the computer. And so the Trader Joe version, it says that it has 1,000 milligrams of omega-3. So the EPA and DHA together was like 300. And the rest of it was all filler. So it's all like filler fatty acid. So all the cheap omega-3s, like that's what they'll do. Like that's how they will get you, is by putting in cheap filler instead. So for example, the one that I have, like that I take personally, is Nordic Naturals. And so, if I look here, then it's got each caps or 2 capsules have 2100 omega-3s, EPA 1100, and DHA is 900. So that in total, so each one has 1000 basically. And so I take 3 to 4 of these a day. But super key to understand this, because that's how they will scam you. But EPA, these are used for depression. So depression, ADHD, OCD, I use it for anxiety, mood stabilizing, bipolar. They're very mood stabilizing. Autism. So because the anti-inflammatory helps with the mood stabilization. Obviously, this won't replace like lithium but yeah. So I pretty much every patient I believe should be on an omega-3. Like that's how important it is. And it's the #1 supplement I'll recommend. So I definitely think you should integrate it into your practice. And you can also get omega-3 labs done, omega-3 index, so that way you can check for this. So yeah, I hope that's helpful. These are the top 5 supplements I recommend in integrative practice. And if you want to learn about all more supplements that you can use for your patients, N-Acetylcysteine, creatine, lion's mane, L-tyrosine, St. John's wort, zinc, saffron, and how to really do integrative care effectively, then definitely check out our Level Up Psych Coaching Academy, where we've had over 160 PMHNPs go through so far and gain confidence in their clinical skills with diagnosis, treatment, and actually being able to get patients better results. So if that interests you, definitely check out our NP coaching community, and I will see you in the next video.